I'm not going to do AI.
Yeah, there you go.
Yeah, right. Excellent. Well, Victoria,
Yeah,
yeah, lovely to meet you. Thank you so much
pleasure.
for agreeing to spend some time with me. Just to talk about some of the burning questions that I've got. Welcome to our podcast, and just introduce yourself and tell us a bit about yourself, please.
Well, I'm a consultant trichologist. Um, I've got a practice, a clinic in Marylebone in London, and I just treat people with all kinds of hair and scalp conditions, essentially. So diagnose and treat. That's me.
And how long have you been doing that?
For 8 years now.
Amazing.
Yeah.
Well done. So, as a trichologist, do you see many men or women that come into the clinic, to your clinic, that have either had cancer or going through cancer and worried about hair loss or their scalp?
Well, I have to say, it wasn't until you've asked me that question that I was thinking, and I've only had two patients. They're both male, so definitely not the typical thing you think of. Both male, both under 40, and they both had locks actually, which is a strange thing. But that was more about the hair loss and what was happening. They were both having immunotherapy, and they developed something which was very strange. The hair loss resembled pattern hair loss, but at the same time there was some areas of traction. So I wasn't really able to distinguish whether or not from photography, from prior photography to before they started treatment, because unfortunately there's so much going on. So just to give you some context here, both of them started suffering, becoming unwell, and then being diagnosed sort of just post COVID. So not only was it a lockdown situation where both of them had changed their locticians, they both had like different styles done, and so many things had changed that they couldn't actually pinpoint what was causing the hair loss. And then they had their diagnosis and started treatment, and then I met them later on. So this whole sort of train of events, it was quite difficult to actually work out what was going on. Was it the toxicity? Obviously, we the little bit I do know about cancer treatment is that it is a poison, and that's why it does what it does to the body. So neither of them could pinpoint it, but one of them had pattern hair loss on top of the traction. So that was looking very, very strange, but we did really manage to make a huge difference and to get that to sort of sort itself out a bit. And it was left with very little, a very small patch. So ultimately, I was left with the thought process that it was probably started off as an areata, because they did say I think there was just one little patch, but that didn't come out until afterwards. And you know yourself, when you're diagnosing people, the consultation is really important. But even though people try their best, they often try and self-diagnose, so they miss out things they don't think are relevant to mention to you. So you have to answer so many questions in so many different ways to just either to delete that from the whole possibility.
Um,
Yeah, so that's the only two I've come across. So not the typical thing you'd expect, which is probably women, breast cancer, cervical cancer, that type of thing. I haven't had anybody come in suffering with cancer at this point or post cancer.
and why do you think, or do you think it's important for professionals in the hair industry to understand a bit about cancer-related hair loss?
I
Is it
think
important?
Yeah, I think it is important, but again, it's a very difficult subject to sort of navigate, because whilst you should really arm yourself with as much information as possible, if it's not your specialist subject, it's really difficult to keep up with even your own specialist subject with with the new comings and the findings of things. So I think it's very difficult to speak in expertise, but I think for personal knowledge, so that you're at least informed, I think that's quite important. Um, from my point of view, in terms of my trichology course uh, at the institute, it's funny, we didn't focus on the outcomes of hair loss due to cancer. The cancers that we were looking at were all to do with scalp cancers, and the sort of the obvious things like malignant melanoma, squamous cells, basal cancers, that sort of thing. And being able to recognize that, because obviously if you're checking someone's scalp and you see something like that, it's really important to act very quickly. The thing with any illness in the body, obviously, the sooner that it's caught and prevented, it's, you know, your chances of survival and recovery are much higher. So that's what. So we really focus on looking at the scalp and looking for these lesions and things like that, as opposed to, okay, what happens once someone's having cancer treatment. We spent a very little time on the sort of single most outcome, which is anagen effluvum, and I understand the process and what's happening to the hair bulb at the time and why that happens. But in
Mm.
terms of any depth, I would never even um, pretend that I have any understanding or what the process is. For I'm a complete novice. I have met Paxman Richard at several conventions, and so I understand about the cool cap and how well that's worked. And so I'm aware of that. But aside from that, I don't have any other understanding. So yeah, I think that there's somehow it would be really good to just have some kind of course or update, or maybe you should do a symposium for us to just update people on things, and in a way that we can probably perhaps best help any patients we have. But as I said, for me, I've only had two people, and um, I can't say they were not really interested in their cancer as such with me, because they were both in remission. So that was probably much more what they were much more interested in. And even with my lack of knowledge, I can understand why they would have recovered so quickly, the immunotherapy, how that works as a process, but more because they were interested to know how they could just recover their hair, and if they could still, what they wanted to do was to keep the locks without having to chop them off. And interestingly enough, that immunotherapy did not their hair didn't fall out. So it wasn't that typical. 90% of their hair didn't come out. It was almost as if there was impending hair loss due to either COVID or the fact that they were entering pattern baldness, and it was just, and that maybe the immunotherapy had pushed them over the edge. And there was just additional hair thinning, and it just happened to be in the pattern form, where maybe again, being hormonal, maybe again that just made that sensitivity, that area in the DHT, perhaps that the testosterone kicked in. There was an imbalance. I'm not sure, but ultimately the treatment that we went through practically rectified both people, and one guy was just left with this very small spot of hair loss, about the size of a £1 coin.
Amazing. Well,
Yeah, and he was kind of almost convinced somewhere in his mind that that was the very first thing he saw. So it was interesting. It was like it had a complete reversal, to the point where what happened beyond that little sort of £1 coin was nothing to do with the £1 coin. That just left, and having looked at his hair under the trichoscope, I could see the hair. I could see the typical, AA kind of pattern
yeah.
that going on. So yeah, again, it's not my expertise, but it was just an interesting thing to see.
Yes, definitely. Sounds great.
Yeah,
The recovery, and you're right, there's so many, quite often with hair loss, there's different things going on as well. So there may
yeah,
be a trigger, and it's a combination of things that are happening in terms of sort of hormonal internally, and obviously hormones being introduced through cancer treatment. Do you think
yeah.
there's any misconceptions that clients have about cancer related hair loss, or that anyone has? What are the misconceptions? What do people believe or think?
I think that all of us have seen all of the films, whether it's on Netflix or it's been a big film. I can't really think of a big film, but any of the Netflix things, or anything that you might watch on Prime Video, and anyone that's had a diagnosis, there's always two characters, and they come home and they do the macro shot of the sink, with the hair, with the but you hear the buzz of the clippers, and then you just see the hair falling in the sink, or you see the person, and you know, you'll see them just frozen, and they just you see they've had the diagnosis, and then you see the oncoming days, nothing's, they're just looking at themselves, they're still in shock, but they'll just touch their hair and it will just come out in their hand.
Yeah.
And they're the two kind of posing factors that you see. And to me, most people, even just in general, when if I speak to friends, or if ever anything like that's come up in conversation,
Yeah.
I think that the general public who haven't been exposed to cancer or cancer treatment, I think they just think, yeah, your hair falls out. It's an
Mm.
inevitability, and it falls out, and that's it. And I don't know whether people really consider, does it ever grow back? Or if they see somebody without hair, they automatically assume that they're actually suffering from cancer, or they're having cancer treatment. They don't really think that there could be another type of alopecia that this person's suffering with, which is quite an interesting one. Um, so yeah, I mean, I just don't think that there's enough awareness in terms of the actual thing. I think people just think you either shave your head or your hair falls out in clumps. I don't think people think about it as a process. I don't think they get that. I think the other thing that people don't really understand is the time factor, and I don't think they understand that why it happens. I think they know that it happens because they know that obviously chemotherapy is toxic, but I think they don't understand that anagen effluvium is because 90% of your hair is in that growth stage at a time, and therefore you're going to lose 90% of your hair. I mean, I might not be right, but that's my sort of understand my
You, you
analogy.
are right.
Yeah,
You're exactly right. So as soon as the drug enters the hair at the growth, it just breaks the hair at that stage and it all falls out. That's the growth stage, isn't it? So you
yeah.
are absolutely right. Do you think many people know about scalp cooling? I know you know. Do you think many
Uh,
people
no, because no, I definitely not, because I do have as I said, I've actually have quite a few female doctors. Um, some of them are pediatricians, and they're younger. They're not really in that vein, or they haven't. That's not something they would have come into contact with. The older women, and these are probably women in their mid to late 30s, 40s, 50s, 60s, and it's come up in conversation several times. And one of them actually has her own oncology. She has a cancer clinic in Lagos, and we were talking, and I'd happened to have just gone on a course right way back in 2016, I think it was, and there was the Paxman that had just, they were rolling out their cool cap, and it was being up, the uptake was there, but it was quite an expensive thing at the time. And I had a long conversation with the guy about what countries was it in and what was happening. And I mentioned Nigeria, and I think he said that there were so many logistical issues, and particularly about the maintenance would be an issue, and to do with the charging, so the electricity, and but I did say, look, these are clinics, they're operating on people, so they have generators, but I think it just wasn't feasible at the time. But this oncologist, she'd heard about it, she'd heard that this is what they were developing it, but she wasn't aware that it was available. So even special, but I'm sure now that all specialists all around the world, they know about cooling. That would just be, I find it very hard to believe that a specialist wouldn't know. It's part of their protocol, isn't it? But in general, I don't think the general public that I have come into contact with would know that a cooling cap is something that's used. I had a barber friend of mine get in contact because his mother was going through chemotherapy, and it was during lockdown. And they contacted me about wigs, and I said to them, but is she not, did they not offer her the cooling cap? And he said, what was that? So I sent him all the links to Paxman. So again, and this is somebody that's in the industry that had quite a few female relatives, and also males as well, that had gone through chemo and all different sorts of things. So on one hand, he was able to sort of comfort his mother, I think, and in that so many of those people that were sitting in his chair had gone through chemo themselves, or their relatives had, and it's the success rate seems to be very high in this country. I'd say a big proportion, 80-90% of people. I don't know what the cancers were. Obviously, they may be varying different types of cancers. They seem to come out quite successfully. But again, most people seem to have them caught very early, and that seems to be the main key with cancer, isn't it? It's that the diagnosis sooner it comes, the better.
Absolutely. And yes, Paxman's in a number of countries, and they are, they're continuing to expand. So it's brilliant that, you're able. It's about raising awareness, isn't it? Because not everybody knows, and it's about having that information and sharing it so that people at least will have an opportunity to use a device that will help to reduce hair loss through chemo.
Yes,
So well done.
yeah, I think that also, depending on your character, but you can't really speak for everybody. But I think generally, if you feel that you've got some sort of control and you've done everything you could, if your hair does still come out, there, I think there's a different level of disappointment just by not doing anything and feeling helpless and thinking the inevitable's coming. I think that just probably, expands everything that you're feeling anyway. But I think if you've got a bit of a challenge and you're already in that fighting spirit and you're trying this, and as we both know, not everyone can tolerate that cap. It's not an easy thing necessarily to do, and I think you've told me before in the past as well that some cancers it's not suitable to just for use just logistically. So it doesn't work for everybody, but it's a great, and it's the only thing really that will have the best chance of you reserving your most of your hair.
Absolutely. In the first like 10 or 15 minutes, when the scalp cools, it will be, some discomfort because obviously we're going from your normal sort of temperature, body temperature, that 37 to 18. So
Chilly.
it's a lot. Yeah, but Paxman's got lots of things on their website to, ideas. Obviously make sure you maybe bring a blanket and you distract yourselves by listening to music if you listen to podcasts, what we're doing today, read a book. And it's the first sort of 15 20 minutes that's the most uncomfortable, and then your body acclimatizes. But absolutely, people have different tolerance levels, and it does give a chance, and especially you've just said, a chance of doing something as well.
Yeah,
Quite often we go through the system and you're doing this because you're told you have to do this and everything else, which is important to follow, and then you have an opportunity to do something for yourself that may give you a chance to keep your hair, or at least keep some of it, because some of it will go. But there's studies and research has shown that following the end of chemotherapy, the hair comes back, and having used scalp cooling cap, the hair comes back thicker and faster. If Rather than if you hadn't used it in the first place.
that's
So
really good. That's really good how that works. And I had no idea that it actually did increase the diameter of the hair. That's really good. It's good to know.
yeah, that's the research. Yeah, it's brilliant. So, how do you think hair professionals, including hairdressers, can offer emotional support to clients that have been diagnosed?
Yeah, I think you see, I think this is where training, the question you asked me, I think a couple of questions before, I think it's actually quite important because again with hairdressers, a jolly bunch. It's I was a hairdresser before for 20 years, and so I figured out that I've done about 20,000 haircuts in my time in my life, and that's an awful lot of people, an awful lot of stories. And the phenomenon, I don't know if you've done any hairdressing yourself, but when you have somebody in your chair, it's like you've got a pair of scissors in your hands, and actually it's almost like the most dangerous thing you can think of. But people seem to be extraordinarily relaxed, and they will tell you everything. I mean, the most personal details. It's actually quite shocking. I don't know what happens to us. It's a bit like when people go on holiday and they get on to go to the airport. These people probably aren't like that normally, but people just act really crazy when they're on an aircraft for some reason. You just know with all the way the behavior changes. And yeah, I think the thing with hairdressers is that there are these codes, these rules that you shouldn't really discuss, religion and politics and that kind of thing, just so that you keep everything really neutral and no sort of arguments sort of begin, or you don't upset your client at the time. But I think the thing about training and what you mentioned that just sprang to mind is that, like you said, the worst thing that you could say to somebody is, oh, don't worry, it's hair, it only grows back. that's what we might say to a client who you've cut their hair, you've actually left it longer because that's what you don't go straight to where they think they want it. And then they've had a time to think and they say, no, take off a bit more. And you do. And then it's too short. That's the response, is that, oh, don't worry, it will grow back, because in 6 weeks, that extra inch you've taken off that makes their jawline, changes the shape of their face, it is quite important, because you won't like yourself until that's where it's at, and you should have listened and you didn't, and that's fine because it will grow back. But you can't apply that same kind of jovial rhetoric to somebody who is suffering cancer treatment, and at the same time you can't sort of just give them a cuddle and be overstep your boundaries. So I think some training in terms of how to deal with people in this situation would be a good thing. Because I don't, I mean, I think for me, I would have just said to somebody, oh, I'm really sorry to hear your news, but that's all. I would be empathizing just as a human being. But then any step beyond that in terms of me advising them, I think I would be out of my depth. I think it would be really dangerous one way or the other to give incorrect advice, because at that point, if you don't have expertise, whatever you're saying is just what you think, but that's not necessarily scientifically correct or morally correct or medicinally correct. So yeah, I think that it's never occurred to me until you asked me the question. I think that, both trichologists, maybe people who also do SMP, and barbers, hairdressers, maybe that it's something that should be included in our general training, or there should be after courses that go along with when you like doing, when you do the first aid courses, that kind of thing. Maybe it should be incorporated in something that is just there, so that it's something we think about.
Absolutely. It's amazing. Thanks for that response. It's very thoughts it's thought provoking, and it's interesting to
Yeah.
um to hear your thoughts as they were as they were developing. That salons can create a safe and welcoming environment then for someone um that's going through cancer treatment, who just newly diagnosed. Because
Um,
I think so.
yeah. So what are you asking? Are you asking me? Or are you saying that you think that that's a possible? You think that that's something that can happen?
I'm thinking, how would so you've got your client
Yeah.
who has been coming to you for many years, and she's now received diagnosis,
Yeah.
and she may just come every 6 weeks because she's just been doing that for however many years. So now she doesn't think she should come again because she's going to lose her hair. How do you still make that environment welcoming? As a trichologist, I remember speaking to someone who had a hairdresser who wouldn't see her because she goes, I don't do hair loss. And it was because she didn't know how
Yeah. That's
manage.
terrible.
But that's fair as well, isn't it? It's about lack of information, knowledge. And she literally did not know. And she actually actively dodged, actively dodged her.
Yeah. Well, the reason
Actively.
that was because I wasn't sure if your tone was exactly how the person told you, and that's how the hairdresser spoke to them. But now you said they've sort of avoided the situation. Clearly, they just felt really uncomfortable with that. And you see, even if she was armed with the fact that people like you exist and that all those other services that are available, if she had that to hand, she'd be able to say, "No, I can't do that, but you can go here. They'll cut your hair 3 times." And you'll be in a much better position, and I'll see you again afterwards. But also something that's sprung to mind, for religious purposes, some religions, they have like separate rooms that women can go to because they are not allowed to show their hair, and it's just a side room, for example. And other people have beauty rooms. They have bridal rooms where they might just be doing a test makeup, and the hair and the veil and all of that's involved at the time. And so you could always have a room like this anyway. And perhaps when the person makes an appointment, you could make the room just, comfortable enough, so that, I'm not saying you have to put a sofa in there, it's not a therapy session, but just make it in such a way that the person isn't embarrassed and the hairdresser feels comfortable. Because I think that the thing about a salon is that even if someone's got mild hair loss, there's nothing worse than sitting there looking in the mirror, and the two people either side of you have got all this. There's got this mane that's been blow dried, and this fabulous hair, and you're there with a few sprigs. That does not do anything for the self-esteem. And so I think that the issue is that it's much more of a private session that's required. Um, and other people who have lots of hair have private sessions. And so the point I was trying to make is that again, maybe one could point people in the direction of the sort of salons that have those private rooms or those facilities to do that.
Brilliant. That's a really good answer. And
Yeah,
that's what we were hoping for, to either have uh, exactly what you just said, or maybe have early appointments, or have like later appointments when
yeah.
it's,
Or
you
they still have
know,
mobile hairdressers these days.
well, I suppose if you're working and you're based in a, I guess that would be extra cost, wouldn't it? If you are still having a salon that's open that you're running, and you're having to close it to do mobile. But of course, if they had that as a service, I'm sure people would pay that little bit extra. I mean, that's
Yeah,
another service, isn't it? If
yeah.
people had that as an option.
There was a point when I just did mobile hairdressing and I didn't have a site, a shop. So there must be. I don't actually know actually if they have mobile hairdressers, but if they did, that would be a service that a mobile hairdresser could really, mobile hairdressers, that would be an extra feather in their cap if they went into, had a training course with somebody like yourself, um, and then they could add that, so but they actually specialize in people having cancer treatment, and then they could take on board all these just the gentle treatments of the shampooing, and perhaps go to the person's home and do a service. And I'm sure a lot of people would take that up.
Yes, I'm sure. Yeah, definitely. It's brilliant. Well, look, thanks for your time. It's always interesting to, explore the services out there, what people are thinking, how we can develop what, our offering to ensure that we're working in collaboration
Yes,
with each other, because no one is an island. So it's important. Collaboration is key. And if we have got the information and the knowledge, and the and obviously, the empathy, because we care about what we're doing, we care
yeah,
about individuals. It's important to be able to sometimes just review our services and think about how we can improve it, really.
that's right.
Brilliant.
That's right. Improve the journey of them regaining their hair.
I think so. And just even, we talked earlier about um persistent chemotherapy induced alopecia, that's permanent hair loss. Sometimes people just want to talk. You just said you don't know what happens. People sit in a chair and all of a sudden they reveal the most personal, bits of information.
Yes,
So sometimes people just want an opportunity to talk. So if they can come into the salon, have that private time, and are able to talk, that helps as well, doesn't it? Helps
yeah.
everyone.
Sure, it definitely
Brilliant.
do. And I'm sure that any other person who's suffered or who has a close relative or friend that has, even speaking to somebody who can then relay that person's story, it kind of just gives you must give people some, level of grounding where they are at. And, it's just so when you've got something else to sort of latch onto, it just makes you feel better.
I think so.
Yeah.
Absolutely. Well, look, thank you for your time.
By the way,
Thank you.
I think you do a great job, because people are in the dark, and it's not something that's knowledge until you need it, and nobody really wants to. It's a bit like I was thinking it's a bit like when people don't want to make wills, when it's or there's an inevitability, but you don't really want to go there because you feel like you're bringing something on. And I think it's one of those subjects as well that people don't really delve into unless they really have to.
And you're right, you don't, and obviously people just don't know what they don't know, so they don't know the questions to ask.
Exactly.
And it's about normalizing conversations. So
Yeah.
if we're working with men and women with hair loss, let's look at all types of hair loss and all different reasons why people may lose hair and how it may affect them. So we can do some of it. We may not be able to do all of it individually, but it's like a jigsaw, isn't it? You just work in collaboration with who can, and signpost where we can as well. So
Yes. Yeah.
thank you, Victoria, so much for your
Pleasure.
time,
Pleasure.
and we'll be in touch. Thank you so much. Good luck with your work.
Thank you so much. Take care.
Thank you. You too. Okay, goodbye. Thank you. Bye.